3 dementia shifts to make right now to feel better in caregiving, have a better relationship with your loved one, and give your loved one the best care possible. I'm sharing 3. I'd love to know which one you will start to shift. Let me know in the comments below. Number 1, stop focusing on difficult dementia behaviors and instead start focusing on difficult dementia situations. When we think about difficult dementia behaviors, we start to think about them not wanting to shower, them sundowning, wanting to go home, agitation, anger, frustration, and we put all of our attention on the person with dementia. But when we do this, we get hyper-focused on the person with dementia and changing them and their behavior. And what this does is that we stop looking at all of the external factors that are playing into the behavior. Even though it might not seem this way, none of the dementia behaviors are happening totally out of the blue, not triggered. Usually there's factors in the environment externally that if we were able to tweak and shift and change, we could start to see massive change in how the person with dementia shows up. So whenever you are faced with a difficult dementia behavior, in reality, a difficult dementia situation, step back and ask yourself, what are all the factors at play here? Who is around? What time of day was it? How did they sleep? What did they eat? What did they do earlier in the day? What did they do last night? All of these things, even though they might not seem like a big deal to us, it could be a big deal for the person with dementia. And it could be the very reason they're starting to show some of these behaviors. And by thinking about it in this way, you're starting to develop the habit of being a dementia detective, which will make it so much more likely that you'll be able to come up with the solution and solve the mystery of why this behavior keeps happening. So instead of focusing on dementia behavior, we're focusing on dementia situation. Number 2, and this is really important, stop assuming and start assessing. When we assume we know what's going on and why the person with dementia is doing what they're doing, then we stop assessing all of the other possibilities, which might be more true and which might lead to more solutions. So for example, I worked with a Careblazer once whose mom was putting tissue boxes on her feet. She'd pull out all of the tissues, throw them on the floor, and put tissue boxes on her feet. This Careblazer thought her mom was wasting tissue. So she was assuming her mom was wasting tissue. And I love using this example because from our perspective and most people's perspective, that's 100% factual. Taking clean tissues and throwing them on the floor is in fact wasteful. However, that's not what her mom was doing. When we got down to the bottom of it and we stepped back, we looked at the situation, not just the behavior, and we looked exactly at all the factors involved, we were able to realize her mom simply wanted something on her feet. If we continue to assume her mom was wasting tissue, every single thing we would have done would have been to stop wasting the tissue, take the tissues away, never let her have the tissues. All of the stuff that would have just made the situation much worse. But when we throw out our assumptions and we start assessing and really thinking, what's going on here? What else could this be? What could this behavior mean? All of a sudden, we got the answer pretty quickly. And so I love this because it teaches us to tap into one of the most important traits, I think, for any dementia caregiver, and that's the trait of curiosity. We have to be curious about what our loved ones are doing instead of just assuming we know what they're doing. It's really hard to know sometimes what's going on in their brain and in their world and how they're perceiving things. And so by having this curiosity, we're much more likely to solve the difficult dementia situation. Number 3, and this might be hard, especially for the older generation that grew up in this world of just following and holding what our doctors and healthcare providers say at the highest regard. What we want to think about here is we want to shift our focus from receiving dementia care only inside of a clinic visit, and we want to shift it to being open to guidance and information and support outside of the clinic visit. In fact, I'm going to turn to Dr. Lang, a cardiologist, who said it beautifully. Let's hear what he had to say.
For most things in a doctor's appointment, we have less than 5 minutes, often less than 1 minute for all teaching during a medical visit. So you come to me with a diagnosis of vascular disease, which is highly interrelated with dementia. Like, I'm going to have like 5 minutes maybe to teach you about everything. Yes, you're never going to have all your questions answered. And then the even crazier thing is like people forget 80% of what the doctor told them the minute they walk out of the exam room.
Have you ever felt rushed out of an appointment, feeling like you left an appointment more confused or with more questions than answers, or feeling like you hardly had any time to get your issues, questions addressed? That's what I'm talking about here. In order to truly get through this caregiving journey in the best way possible, we're going to have to turn to resources outside of the clinic visit. There is no way on any planet that 5 minutes during every appointment to answer your questions, and the appointments are 6 months apart or 4 months apart even, is going to be enough. You're going to have to take matters into your own hands. In fact, right here, there's a report from the Alzheimer's Association that found that 82% of primary care providers and the front lines of providing dementia care are not confident in their care with patients who have Alzheimer's and other dementias. So 82% of PCPs say they are on the front lines of providing dementia care, but not all are confident in their care for patients with Alzheimer's and other dementias. Nearly 2 in 5, 39%, report they are never or only sometimes comfortable making a diagnosis of dementia. 27% report they are never or only sometimes comfortable answering patients' questions about Alzheimer's and other dementia. 22% of all PCPs had no residency training in dementia diagnosis and care. And of the 78% who did receive training, 65% reported that it was very little training. We cannot rely on just the doctors. The doctors are important. Please continue to go to your appointments and healthcare visits. It is extremely important. But if that's the only thing you are relying on, you are going to be at a significant disadvantage and struggle more than you need to. Turn to trustworthy resources that are out there. For starters, this YouTube channel is a great place to be. Alzheimer's Association website is a great place to be. Be mindful that you want to know the information you're getting is from a trustworthy source, and that you don't overwhelm yourself. I suspect, and I think it's already happened, that as this field of dementia care grows, because more and more people are getting dementia, and so we see more and more people coming to the field to try to help, which is a wonderful thing. But sometimes when we follow too many people and we take in information from all these different sources, it can be a source of overwhelm when you're wondering, okay, who do I follow? What do they say? Okay, this person said something different. Choose 1 or 2, maybe 3 really great sources and just consume your information from them. And then when you feel like maybe you've graduated from somebody or you're looking for a different perspective, you can move on to somebody else. But all to say, we can't just rely on the PCP visits for really great dementia care. You're going to have to look for help and support and guidance outside of the clinic walls. Now, if you want even more hands-on support and guidance, I invite you to check out our care course, where we do weekly support groups, regular question and answer sessions. There's a private member area where you can connect with other Careblazers in similar situations 24/7. There's a link below in the description where you can learn more and see if you'd like to join us. In the meantime, I'll be back with a new video. But the big message this week, Careblazer, is that the dementia care is in your control. Take that control. You can do this. It can be easier. I promise. All right. I'm sending you so much love. Bye. Also, Nico gets a belly rub for every person who subscribes from this video. So if you haven't already, click the red subscribe button. It's totally free. And Nico says, thank you very much.